my name is Jocelyn Invernon. I'm in the PN program at Williston State College, and today I'm going to be doing insulin injections administering subcutaneously and an insulin pen. So to begin, I'm in my med room, and I'm going to start by comparing my MAR to my provider's orders. So first, I'm going to confirm who my patient is, and it looks like it is Shirley Coast. She's a 54-year-old female. Her date of birth is 5/14/1964. That is the same on my MAR and the same on my provider's orders. It looks like she does have an allergy for codeine, so I need a note to check that bracelet on her wrist when we get in there. And now I'm gonna go ahead and check the meds that my provider has ordered. So it looks like we have a demo dose of NPH insulin, U100, 15 units sub-Q, and that is the same over here, a demo dose of NPH insulin, U100, 15 units sub-Q. I have a demo dose of regular insulin, U100, 10 units. I have a demi-dose regular insulin U100 10 units, and it looks like I have a Practi Insulin Lispro U100 insulin pen. I have a Practi Insulin Lispro U100 insulin pen. And I do make a note that I have a sliding scale here, and my CNA did go in and check on my client and take her glucose, and it was at 178. I went in and checked on my client, and she is not showing symptoms of hyper or hypoglycemia. So I'm going to go ahead and start by preparing her meds, and when I came out, her meal tray was on the way in. So to begin, I'm going to confirm that this is my client's bin, and it's Shirley Coast, 54-year-old female, 5/14/1964. That is the same on my MAR and my provider's orders as it is on my bin. So I know that I'm going to do my first medication check by pulling them out of the bin. So I'm going to grab my tray. And I'm going to go ahead and start with my demi-dose NPH insulin U100 15 units. So that is right here, NPH U100, and that is for Shirley Coast, 54-year-old female, 5/14/1964. So that is my first med. The next one is going to be my demo dose, regular insulin U100 10 unit sub-Q for Shirley Coast, 54-year-old female, 5/14/1964, and that is that regular insulin. And then next I have that Lispro pen, and I'm going to verify that this is Shirley Coast, 5/14/1964, so same client, and that is the pen. So that is going to be my first med check. I'm going to go ahead and perform hand hygiene and get some gloves. So to begin, I'm going to get 2 alcohol preps, and I'm going to clean the tops of both of my medications. And while I'm doing this, I've checked expiration dates, I've checked the color of the medication and the integrity of the bottles, and they are good to go. I'm going to use a different alcohol prep for the tops of each of these. Cleaning for 10 to 15 seconds and making sure that they are dry before I use them, getting rid of both of those. I'm also going to make sure with my NPH, it is a cloudy insulin, so I'm going to roll that in between my hands very gently, not to create air bubbles, making sure to just get any of those particles mixed in before I draw that up. And this is going to be a mixed insulin, so I have checked on my drug guide. I know that NPH and regular are safe to mix together, so I've already checked that. And I know that when mixing, I always need to go clear to cloudy when drawing up, but since they are in the same syringe, I need to make sure and put the air in my NPH before I draw up my regular. So I'm going to begin by getting 15 units of air in my syringe. I'm going to uncap and put that into my NPH first. And then I'm going to drop 10 units and put that into my regular, and then draw up my regular right away. And while I'm doing this, making sure that I have no air bubbles, drawing to 10 units first. I'm going to just double check that there's no air in here. Looks good to me. And then I'm gonna go straight for my NPH. And it's important to not get any air bubbles in the second round because I cannot redraw. So I'm gonna draw 15 units, so up to 25 units altogether of the mixed insulin at eye level, making sure that plunger is level. I'm going to now have my second nurse verify my amount. I'm going to recap my pen or my needle using the swooping method, ensuring to grab the base of the cap when clicking it in. Now I'm going to label my syringe. My insulin number 1 is going to be my NPH, 15 units. My insulin 2 is my regular, and that is 10 units. I'm gonna initial, and the date is 10/7, and this is for my 7:30 meds, and it is 7:15 right now. So I'm gonna complete that label and put that directly onto my syringe here and put that on my tray. And these are multi-use vials, so I'm gonna put those back and store them properly. Next, I'm going to get my Lispro pen ready. So I know that with her blood sugar at 178, according to my sliding scale on my MAR, I need to give 2 units. So I'm gonna begin by uncapping my pen and making sure to disinfect the top of this. 10 to 15 seconds, making sure that it's dry before I put my needle on. I'm going to get my needle here, checking the integrity. It is closed, it's not expired, it looks good. So I'm gonna go ahead and open that, and I'm going to put it on the top of my pen, tightening until I feel resistance, but not any further than that. So when doing this, I'm going to uncap and I need to prime my pen. So I know that with my sliding scale, I need to give 2 units. So I'm going to prime to 2 units, and I'm going to press it twice, making sure that I have 2 little drops come out the top. So that is primed. I'm going to get back to my 2, and I'm going to recap now. Make sure that my nurse checks this. I'm going to throw away all of this. Now I am ready to go into my client's room. Leave that in my med room and head into my client's room. So hi there, Shirley. My name is Jocelyn. Today I'm going to be your nurse. Can I get you to verify your name and date of birth? Okay, Shirley Coast, 54, 5/14/1964. Perfect. I'm just going to check that to your wristband as well. And I am making a note that you are allergic to codeine, and that does say that right here on your MAR. So it looks like you need some insulin today. I have a mixed insulin for you. Do you do that at home? Okay, perfect. So I have 25 units to give you in there, and we do have Lispro in your pen. So it looks like you have your meal in front of you. I'm just gonna go ahead and give you these injections and get out of your way. So I'm gonna perform hand hygiene again and get a new set of gloves. Shirley, where do you typically inject your insulin? Okay, in your stomach? Okay, we're gonna do that today as well. I'm just gonna make sure and rotate the area that I do it, since we are doing 2 injections. And when doing it in the stomach, I need to make sure that I'm at least 2 inches away from the umbilicus. So to begin, I'm going to lower my client's bed rail, make sure that the bed is at a comfortable height for me. And I'm going to do my 3rd medication check. So to begin, I'm going to do my mixed insulin, and that is the NPH insulin of 15 units, checking my label, NPH insulin of 15 units, and my regular insulin of 10 units, and that is correct per my label. So before I begin, I'm going to provide privacy for my client, and I'm going to clean the area that we will be giving the injection. We're going to start over here. I'm going to clean this area really well, 10 to 15 seconds, and letting it dry before I do her injection. Okay, I'm going to uncap my needle. I'm going to make sure and pinch my client's skin, and this is just to decrease sensation so it doesn't hurt as much. So Shirley, we're going to go ahead and I'm going to give you that insulin on 3. 1, 2, 3. Noting where my bevel is and noting that the hub of my needle is pushed right flush with their skin. And I'm going to inject at a slow and steady rate because it may burn. Perfect. I'm going to now activate my safety on an inanimate object and putting this directly into the sharps container. And next we're going to do the pen. So Shirley, how about we try over here with your pen this time? So I'm going to alternate the area. I'm going to clean that second area as well. 10 to 15 seconds, making sure that it's dry. I'm going to do my third medication check on this Lispro pen, making sure that it is for Shirley Coast, 5/14/1964, and it is 2 units. So I'm going to have my nurse confirm once again that that is at 2 units. I'm going to uncap. I'm going to hold the pen in my hand firmly. I know that I need to grasp my client's skin again, and I need to, when I push this into her skin, I need to make sure that this device, the white part, is flush with her skin. Making sure not to put my thumb on the injection site, injecting part of the pen until I'm ready. Okay, Shirley, on 3, we're gonna give you your Lispro. 1, 2, 3. I'm going to inject, hear it click. I'm gonna hold it there for 6 to 10 seconds. 1, 2, 3, 4, 5, 6. I'm going to release, making sure that the safety device on my pen was activated, and inspecting the skin and making sure that it doesn't have any insulin on it. I'm going to recap with the safety device, making sure that it was already on there. I'm going to unscrew it from my pen and put this directly into the sharps container. And before I did begin, I did assess my client's skin and making sure that both the areas for her injections were free of any bruising, they weren't red, there was no visible veins on the site, and they were good sites to go ahead and put those injections in. So now I'm going to clean up my station. I'm going to sign off on my medications that I administered today. I'm going to make sure and put the site for each of those. I'm going to make sure and stay at my client's side after I gave those, ensuring that she doesn't have any reactions or episodes to her insulin injections today, making sure that she eats that food because the onset of her Lispro pen is 5 to 15 minutes, which is why it is so important to have food in front of her. And the onset of that mixed insulin of NPH and regular is between 30 and 90 minutes. So I'm going to make sure and document and stay at my client's bedside.